Dear students, again we have come up with one more video, definitions and concept in infectious disease. Many a time question related with the biological transmission asked in the exam. So there are several types of biological transmission, various vector in various diseases. Number one is propagative. What do we understand by propagative type of biological transmission? Here, the agent merely multiplies the vector and no change in the form. So, the example of propagative type of biological transmission is plague bacilli in the rat flea. We can remember by mnemonics P4P, plague propagative. Another important biological transmission is cyclopropagative. What happens in cyclopropagative? Agent changes in the form and number also. So cyclo as well as propagative. Form is changed as well as number is changed. The example is malaria parasite in mosquito. How we can remember this type of biological transmission? The mnemonic CPM, cyclopropagative malaria. Okay. Third one is cyclodevelopmental. Here, the disease agent undergoes only development but no multiplication. The example is microfilaria in mosquito. How we can remember this type of biological transmission? With CDF, cyclodevelopmental filariasis. Two more types of biological transmissions are also happen. One is transovarial and another is transstadial. What happens in transovarial? When the infectious agent transmitted vertically from infected female to her progeny in vector. What are the example? Example is dengue mosquito, dengue virus in the dengue virus or chikungunya virus in Aedes mosquito. Okay, here we see the transovarial type of transmission. Next one is transstadial. What happens in transstadial? Transmission of the disease agent from one stage of the life cycle to another. For example, nymph to adult. The example for this type of transmission is hard tick for CCHF. Next important definition is nosocomial infection. What do you understand by nosocomial infection? Infection originating in a patient in a hospital or other healthcare facility. We need to remember that it denotes new disorder which was neither incubating nor present at a time of admission and it appears after the discharge. So what are the examples? Surgical wounds infection. Most common surgical wound infection is the nosocomial type of infection. Hepatitis B can be there or urinary tract infection related with the catheter. What is the heterogenic disease transmission? Heterogenic disease transmission is kind of doctor generated disease, or we can say adverse effect following preventive, diagnostic, therapeutic, surgical procedure. And this disease may be serious enough to prolong the hospital stay and it requires special treatment or actually can be a life threatening. Example can be hepatitis B following blood transfusion, reaction to penicillin, or reaction following immunization. Three important definitions for any of the infectious disease are disease control, disease elimination, and disease eradication. So, what do we understand by disease control? Disease control means there are kind of four examples in type of disease control. Which are they? It ongoing operation aimed at reducing first of all incidence of disease. Second, duration of the disease. Third, the effects of infection. It can be both physical or psychological complication. And fourth one, reduction of the financial burden also to the community. For example, malaria control, okay, versus malaria eradication. We'll see the definition of eradication in later part of our discussion. At that time, the query of this malaria control versus malaria eradication will be sorted out. Elimination means interruption of the transmission of disease. It is the midway between the control and eradication. Like it can be an intermediate goal, that is regional elimination. You must be aware that now we have eliminated polio from Southeast Asia region, leprosy from India. So these are the example of elimination. It is a kind of pre-eradication scenario in which we just interrupt the transmission. So we see no any new cases. But still, in other parts of the world can be providing the cases. What is the eradication? It is the termination of all transmission of infection by extermination of infectious agent. It is an absolute process and it can be a all or none phenomena, or we can say it is a tear out by roots. So nowhere in the world you can see the that particular disease. It is called disease eradication. So here malaria control means malaria will be there, but it is in endemic kind of situation in which you will see a few cases. But eradication means you won't see any single case in all over world. So far, only one disease has been eradicated, that is smallpox.